Hello, in this video we will discuss about the diabetic ketoacidosis, for short DKA. It is a true emergency. Death may occur if not treated. An acute metabolic complication caused by insulin deficiency. When insulin will be decreased, so the keto acids and ketones will be produced. This ketones body when increased will lead to complication. So let's begin to understand the whole process and their treatment and diagnosis as well as symptom. So first of all, we should need to understand the pathophysiology. So the mechanism we will not go understand. We will not understand about the biochemistry for the ketone production and ketoacidosis, but just for our view, we can understand. So this is the person which does contain pancreas. Pancreas contain islet of Langerhans, contain alpha, beta and delta cells. So it is endocrine cell, produce hormone insulin from beta cell. Alpha cell produce glucagon and growth hormone from somatostatin, from delta cell somatostatin. So the insulin basically is the hypoglycemia will lead to increase the glucagon, while the hyperglycemia will trigger the insulin production into the blood circulatory system. So this is the pancreas, and this when we will intake food, so the diabetic person will lead to hyperglycemia. So the normally if we will discuss, this is the pancreas will trigger to produce insulin when hyperglycemia will be occur. So after this it will be clearance to lead to isoglycemia. But the pathophysiology in the diabetic person, which that we will discuss if, so the hyperglycemia will be occur in the diabetic person is more than 300 milligram per deciliter the glucose level. So in this way the disturbance in physiology will be abnormal. So in this way here is basically the insulin deficiency will lead to decrease the ATP production, will lead to gluconeogenesis from the fat as well as fat and glycerol, fatty acid and glycerol. So on the other hand, the hyperglycemia should be in the diabetic person 300 milligram per deciliter and more. So this is the when urinary system, the nephron is the unit of urinary system. In this way, the hyperglycemia for isoglycemia and hypoglycemia, the excretion of the glucose from the kidney. So the osmotic diuresis will be occur. In this way, the glucose will take also water to excrete the glucose. When the glucose will be excrete is known as the glucose urea, and this polyuria will be occur again and again. And in this way the loss of electrolyte, for example sodium and potassium, will lead to life threatening hypokalemia. So in this way, and water and dehydration will be occur, and this will lead to polydipsia and polyphagia. And we can check through glucometer glucose if present in the urine, so we can identify the hyperglycemia and diabetic person, because the dysfunction of the pancreas or the dysfunction of the insulin sensitivity. So the polydipsia and polyphagia will be occur because the continuously loss of water and continuously loss of glucose. But in this case, hypoglycemia, which that will be occur when the excretion of glucose, and this hypoglycemia will lead to increase from the pancreas to produce glucagon, because glucagon is the catabolic hormone, and this will be catabolized. So the catabolism of the fat and muscle. So when increase the glucagon will lead to target the adipose tissue. Adipose tissue means contain the adipocytes, and these adipocytes contain a trialysyl glycerol, which that is the fat storage formation. The fat will store in the form of triacyl glycerol, and when the glucagon receptor are present in the adipocyte will bind with the glucagon, and the glucagon receptor are bound or epinephrine receptor are, with a muscle cell when bind will lead to glycogenolysis, and on the other hand when bind with the adipose tissue will lead to triacylglycerol breakdown through human sensitive lipase enzyme to produce free fatty acid and glycerol. This free fatty acid and glycerol will produce the ketone body due to the alternate form as compared to the glucose, because the keto and aldo sugar, so the acetaldehyde and ketones will be produced, the keto sugar and aldo sugar. Basically it is type of glucose but alternative form. But in this way the excessive amount of when glucose will be increased, so in this way the muscle cell break down the glycogen to produce glucose first initial phase, and the liver will function same, and in this way the gluconeogenesis will be occur to produce, and this produce more glucose for the consumption of energy. But this glucose will not work, so excrete again and again excretion loss of glucose, and the ketones will be produced, and hyperketonemia will be occur due to the liver will produce ketones, so it is known as the ketogenesis. If you don't know about the ketogenesis, so you can watch my previous video about the ketogenesis biochemistry and the ketoacidosis. So this is the nephron. This nephron is basically the urinary system unit of urinary system. So the in this way the basically is the again hyperketonemia, the ketones will produce more, and in this way the excretion of ketones also occur, is known as ketonuria. So in this way the acute infection and stroke and pancreatitis trauma and drug thiazide diuretics which that will lead to increase the ketonuria, and in this way the because the loss of glucose will lead to ketonuria, and in this way we can check through ketometer. If ketones are present, so it means the ketosis is working. But it is just opposite to the fasting, because the fasting trigger only the ketogenesis, but in this case the diabetic person will continuously produce ketones because the glucose is not working too much. So anyhow, let's begin to understand the symptom of acidosis. So the symptom of ketoacidosis may be uh, maybe you can understand the nausea and vomiting. Why vomiting will be occur? Because vomiting will be occur due to the excessive amount of ketones will lead to decrease the appetite, and in this way the glucose will not working, and that is why the vomiting will be occur, because the sympathetic nervous system activation, while nausea here and confusion, loss of consciousness and coma, and tachycardia 100 beat per minute can be possible. And during the breathing the rapid deep breathing will be occur. Why? Because the high blood pressure will be occur due to the sympathetic nervous system activation, due to the hyperglycemia, and in this way the fruity breath order will be occur, and we can sense, and hypotension will be occur when the loss of glucose, when hypoglycemia, so the kidney stone formation and muscle fatigue because the glucose is not working, and in this way the basically in this way the glucose will not working, and there are a lot of complication will be occur, and sympathetic nervous system will lead to increase the glycogenolysis and lipolysis due to the production of glucagon. So the basically sympathetic nervous system is the catabolic. So the diagnosis is anion gap metabolic acidosis. Arterial pH will be 7.30 with anion gap more than 12, and low serum carbonate, low serum hydrogen bicarbonate, and more less than more than 50 milliequivalent per liter. So in this way we can check through diagnosis, and on the other hand we can check through a glucometer by the puncturing through needle, and in this way you can understand this hyperglycemia or hypoglycemia will be occur. If the hyperglycemia will occur, in this way it will we can manage, and through this is the management we will discuss. So we can manage by insulin when hyperglycemia will be occur. But if insulin will working through diabetes mellitus 1, not diabetes mellitus 2, so we can when hypoglycemia will be occur, for the management, if so the glucose tablet will be used. On the other hand, the fruit juices will also trigger the hyperglycemia if the hypoglycemia will be occur, for the management and the homeostasis of the glucose metabolism, for the prevention of ketoacidosis, for the production of ketones, and so in prevention of ketones. So when the insulin not working inside. So on the other hand, here is the insulin. When inject, that insulin will bind with the tissue. So the normal physiological function, the glucose will move into the tissue for consumption. So the when glucose will consume, so the ketone will be inhibit, while the when glucose will be not consumed, hypoglycemic time, so the ketones will be produced. This excessive ketone will lead to ketoacidosis, because the breakdown of protein will produce the keto acid from the amino acid, while the on the other hand there are a lot of ketones will produce. On the other hand, the management primary airs is basically intravenous fluid will be transfused, because the loss of the sodium and potassium. So when loss of sodium and potassium, life-threatening hypokalemia will be managed. While here the step 1 is the rapid intravascular volume repletion intravenous fluid through intravenous fluid, and regular insulin bolus followed by intravenous infusion till serum potassium is uh, less than equal to 3.3 milli per equivalent, because the potassium is the intracellular cation, and correction of hyperglycemia and acidosis, and correction of the metabolic abnormalities, clearance of ketones, prevention of hypokalemia and hypophosphatemia, which develop during treatment of diabetic ketoacidosis. So in this way, the potassium will be again provide through intravenous fluid, and for the electrolyte balance, because the loss of the potassium due to the polyuria, and on the other hand the polydipsia, because the water will be excreted through urinary system. So